Gracious God, many are the challenges faced by physicians in our country today. For example, good doctors are challenged to be mindful of the best practices in the science of medicine today and the enormous variations of the human body. If that were not enough, they are also challenged to make their patients their first concern, promote the health of the public, dedicate themselves to ongoing professional education, and work in respectful partnership with the interdisciplinary healthcare team. All this is to be done in honesty and with integrity. So we gather here today, O God, that these doctors may receive the blessing and also the rewards necessary to sustain and enrich their lives and those of their families amidst their long hours of service. In doing so, we are asking you for that soulful blessing upon this charter class of new doctors at the University of South Carolina School of Medicine, Greenville. In your holy name we pray. Amen.
Thank you, Dr. Hartman. It's a real, as I said earlier, a real honor to kick this off, and I have the distinct honor to introduce the class president, Ryan Batson. But before doing this, I want to tell everybody a little bit about the whole process of the white coat ceremony and what we in the planning phases of this really worked through to think about this. The white coat ceremony is something that's been around probably 20 years or so. It's been the early 1990s. I think the first one was University of Chicago in 1989, long after I went to medical school. And when you start a medical school, as we did from scratch, every little detail you have to think through. Every little detail that you can't even imagine, somebody brings up and says, are you going to do this, or are you going to do that? And I distinctly remember the question came up, what about a white coat ceremony? And we were so ingrained in the details of trying to figure out what the curriculum was going to look at or how we're going to recruit faculty to the school, that something like a white coat ceremony seemed to take back seat. But as it emerged and time went on, I remember studying it, and we made the decision very distinctly to go ahead and have a very robust white coat ceremony and to embrace it. And the challenges that were brought up as arguments for and against, I thought were pretty interesting. And some see this as really a very ceremonious occasion and a real rite of passage, a celebratory honor of getting into medical school, while others look at it as a little divisive, that the white coat can sometimes be a barrier between you and the patient, that you're better than the patient. It can be looked at as a title, an entitlement mechanism, that you wear a white coat that nobody else does. And these were arguments that we considered. But then when you look at our school and what our school is about, we've said over and over again, this is about immersing young people into the medical environment from day one, from the time they come to the medical school to the time they finish. You're part of this healthcare team, and you're going to be part of the healthcare team, albeit the first 2 years very more passive than active, but you're going to be receiving and learning knowledge. But if you hadn't figured it out by now, in the first 9 weeks of medical school, well, now you're actually providers of healthcare. You're EMT certified, trained providers of healthcare. You're a member of the team. And by virtue of being a member of the team, you get a white coat. And I encourage you to wear your white coat and feel that you should. Remember what we said, you're going to dress like a doctor, act like a doctor, be expected to wash your hands like a doctor from day one, right? You had to tell us what it was to dress like a doctor. You did a good job with this. And I think the white coat was one of the things that was part of your dress code that you felt like you should wear. So we encourage you to wear this. And then the only other tidbit I will share with you is understand the responsibility. This is not about entitlement. This is about responsibility. This is the biggest step you're ever going to take in your life. Responsibility of caring for patients, responsibility of the health care of our community, and you're sharing that by taking this white coat. So this white coat's not entitlement. It doesn't make you better. It just adds the responsibility that you're going to have to provide the care that we know that you're going to for the next years, for the rest of your professional life. So wear it proudly, wear it daily, and we're excited to be part of this ceremony for you. Ryan Batson is now going to come make a couple of comments. He's the class president. I think was elected this past week, landslide election. I heard there was 10 people that ran for president, so that was more than the Republican and the Democratic national election. Ryan?
Thank you, Dr. Taylor. It was certainly not a landslide, but I appreciate that. I have to say this is the largest crowd I've ever drawn, so thank you very much for coming to hear me speak. I know you all probably have dinner plans, so I'll try to wrap it up in time for that. First, I'd like to thank you all for coming to witness this milestone in our medical careers. It's truly an honor to be here today getting our white coats. I remember when I got my email from Dr. Catalana saying I'd been accepted. Threw my hands up in the air, jumped up and down, turned to my 4-month-old daughter and said, "Yes, I got in." And she smiled back at me and gave me that, "I'm so proud of you, Dad," look. It was very special. You know, the road to med school is so long and difficult that you begin to wonder if you'll ever get there. But here we are. We made it to that destination. I guess if med school is like a cross-country road trip, we've now successfully made it out of the driveway. Family and friends, your support and our hard work have gotten us this far, and I know the training we'll receive over the next 4 years will make us doctors well prepared for residency. Our class has received so much care and support up to this point from the faculty and administration that I know my decision to come here was a good one. During my interviews, it was clear to me that these people cared not just about learning, but about students. And they believed in the med school that they were building, and that faith is infectious. It inspires us to believe that we might just be able to do this. We're privileged to have a faculty of physicians and scientists who are well known in their fields, and I could list their qualifications for you, but then I'd have to break my promise about getting you out of here in time for dinner. But it isn't just the people that make our school special. Our building is so technologically advanced that every now and then we get to teach our professors a thing or two. I've told people it's like going to school on a spaceship. We have these huge computer and TV monitors in almost every room. We have the ability to reserve study rooms electronically. Most of our books are on our iPads. We have mannequins that give birth, have heartbeats and blood pressures, and even vomit. That's true. But I think that the most amazing thing about our building is it allows us to communicate in a way that we haven't been allowed to since early childhood. We get to draw on the walls with markers. So what do you fill a building that impressive with? Equally impressive students. I've had the honor of being selected by my classmates to represent them to the faculty and to the other schools on campus, and it truly is an honor to be able to serve as the class president of the finest group of people I've ever been a part of. I think our class is rather special. We're already having an impact on the classes that will come after us. For example, we have determined what the dress code will be for our school, and even though we were given basically free rein, I think that the results look very professional. We've written our own white coat oath, which we will take shortly, and about a week ago we were put through 2 simulated mass casualty incidents involving EMS, police, and fire department personnel, which we were responsible for handling like real EMTs. And I think that we did. We handled it just like the brand new EMTs that we almost are. According to our professor, Dr. Blackwell, that's something that no other medical students in the world do. I think the benefits of our EMT training go beyond just making us useful right off the bat. They also give us a unique insight into our patients' lives and the medical needs of our community. How many first-year medical students get to put their hands on real patients? And how many get to actually pick their patients up and take them to the hospital? We're getting the opportunity to see exactly where our patients come from and how their home lives and their personal choices are affecting their health. Part of our curriculum will be to, from time to time, pick up a patient, follow their progress through treatment, and check up on them after discharge. It's that kind of total care that we hope will significantly change the overall health of our society. So how did we get to this place in our lives? Some of us have known we wanted to do this since we were children. For some of us, it took a little figuring out. Some of us are fresh out of college, and some of us are a little more seasoned. We have classmates who have spent time in the military and some who just joined a couple weeks ago. We have some bachelor's degrees, some master's degrees, and even a couple PhDs. Some of us have a first language other than English. But despite our differences, or maybe even because of them, we're becoming what looks to be a strong and closely knit inaugural class. I could go on, but you, our family, already know all the great ways I could describe my classmates, because you helped make us who we are, and without you, none of us would be here. So on behalf of our class, thank you very much. I knew that sounded too much like a closing. I'd actually like to close with my hopes for the future and maybe a few wise words. For you, family and friends, I hope you'll be patient with us and remember that we love you just as much as we did before we had to study all the time. To the faculty and administration, I hope you'll keep your compassion and enthusiasm, knowing that we're always looking to you for guidance. And to my classmates, I hope we'll be colleagues and not competitors, there for each other both in and out of the classroom. And finally, if you'll permit me a little inside joke, I would like to offer an EMT toast to all of us. No matter what station we draw in life, may our learning never fail us when it is critical. May our assessments always be accurate. May our scene always be safe. And may we always remember our BSI. Thank you, and now it's my privilege to introduce our Dean, Dr. Jerry Yuki.
So one of the things that I should point out to those of you in the audience now, actually two things. Number one, ironically, the group in this audience, including myself, the folks behind you, my faculty sitting out, clinicians and PhDs, that would be most comfortable stopping at the scene of an accident this afternoon actually is the students. Just sort of, the other physicians in the audience will understand that very well. The other thing I'd like to tell you and point out to you is after that extraordinary set of remarks that Brian just gave, none of you really have the opportunity to know all of these students like we're becoming familiar with them and getting to know them. And although Ryan was selected as the president of the class, I want you to know that he truly does represent this class. This is an incredibly unique group of young men and women. And so what you heard today isn't necessarily the person they elected as leader of the class. You heard today the person that they asked to represent them. And any one of them could have come up here and given the address. It's a remarkable group of young men and women. So, having said that, I'd like to start off by introducing the people who are on the stage behind me. I'd ask each of them to stand as I tell you who they are and what they do. I'll start, Reverend John Hartman, you met already. John, you want to say hello again? So, and I'm going to start behind John and we'll work our way forward. So Dr. Brian Tobin. Brian is our chair of the Department of Biomedical Sciences. Next to him is Dr. Brenda Thames. She's actually the GHS Vice President for Academics. Next to Brenda is Derek Payne, our Chief Business Officer for the School of Medicine and for academics in the hospital system. Next to Derek is Dr. Lynn Crespo, our Associate Dean for Education. Next to her is Dr. Jim Buggy, Associate Dean for Student Affairs. Next to Jim is Dr. Robert Best, Associate Dean for Academic Affairs. And then there's John, who's already been up. Next to him is Dr. Paul Catalana, Assistant Dean for Admissions. Next to him is Mike Reardon, CEO and President of the Greenville Hospital System. Next is Dr. Spence Taylor that you met. Spence actually didn't tell you this, but he is the Senior Associate Dean for Academic Affairs and Diversity to the Medical School, and is the Chief Academic Officer on the hospital system side. And then finally, I'm Dr. Jerry Yuki. I am the Dean of USC School of Medicine, Greenville. And on the hospital side, again, emphasizing the integration of the hospital system and the delivery system, I am the Executive Vice President for Medical and Academic Affairs. And having said that now, the one person that you've not met, it is my privilege and pleasure to introduce, and that's our keynote speaker, Dr. Joanne M. Conroy. Joanne is the Chief Healthcare Officer of the Association of American Medical Colleges, the AAMC. As the Chief Healthcare Officer, Dr. Conroy focuses on the interface between the healthcare delivery system and academic medicine, paying particular attention to how healthcare in academic settings can address quality of care and patient-centered care issues. Never in our history has this interface been more critical. Dr. Conroy represents the interest of approximately 400 major teaching hospitals and health systems, including 64 Veteran Affairs Medical Centers through the AAMC Council of Teaching Hospitals, COTH, and Health Systems, COTH, in addition to overseeing the Group on Faculty Practice, the Group on Resident Affairs, Chief Medical Officers Group, and the Compliance Officers Forum. Dr. Conroy came to her current position after serving as Executive Vice President of Atlantic Health System and Chief Operating Officer of Morristown Memorial Hospital in Morristown, New Jersey. In those roles, Dr. Conroy gained an understanding of health system operations, hospital-physician relationships, and collaborative partnerships among the various elements of academic health systems. Dr. Conroy earned her Bachelor of Arts degree in chemistry at Dartmouth College and was awarded her MD degree from the Medical University of South Carolina, where she then served as chair of the Department of Anesthesiology and subsequently Vice President of Medical Affairs for MUSC and Senior Associate Dean and Dean of Admissions for the MUSC College of Medicine. But of most import for us today is that she is a friend of the Greenville hospital system and a trusted colleague who has provided to Dr. Taylor, Mike Reardon, and me valued support and needed encouragement in the development of University of South Carolina School of Medicine, Greenville. She is an integral part of your history. Joanne?
Good afternoon. Thank you, Jerry, for that wonderful introduction. It's really a pleasure to be here to welcome the first class. Putting on my Washington hat, I believe there's going to be a significant shortage of physicians in the future, and we are very focused on creating not only numbers of physicians to meet the need, but quality and compassionate physicians to meet that need. As a former South Carolinian, I'm very interested in creating physician workforce that will help not only serve the state, but maybe reinvent the healthcare system in the state. And finally, as a person whose family members receive their health care at Greenville Healthcare System, I'm very interested in making sure that there's somebody who will continue to care for my family in the years to come. I was really very honored to be invited to address you. It's interesting, this event is one of the first of many celebrations that you'll participate in, but it's really the first step, just like you're leaving your driveway, on the journey to your medical degree. But it's going to be challenging, consuming, demanding, and exhilarating all at the same time. But this ceremony is supposed to emphasize that in addition to the acquisition of a tremendous amount of information, you are going to have to appreciate the equivalent importance of compassionate care of patients in order to be great doctors. We all know that patients can sense when their physicians are empathetic. They're more forthcoming about their symptoms. This, of course, will help you diagnose things more accurately, and they will participate in their care more. Those are really all good things. So why are we concerned about empathy and compassion? Why do we need to have this ceremony? Historically, something has happened. Medical students have been surveyed and reflected that during their training they feel vulnerable and perceive that they carry a heavy burden of responsibility that results in negative coping mechanisms. You've all seen this on TV. Callous, dismissive, gallows-type humor. Scrubs, Grey's Anatomy. And for your parents, I'm going to date myself, St. Elsewhere, ER. But, you realize that that happens. Think about William Hurt, who was in the movie The Doctor. Before he actually became a patient, his attitude towards patients was a little chilling. These negative coping mechanisms are only intensified, however, by anxiety and stress. And students begin to feel like they lose their humanity. I've stood in front of students and residents and said, I don't know what happens in medical school and residency training, but we do something to you. One student who was pretty brave stood up and he said, no, you do it in medical school. And that was really the motivation to really intensify what is the environment we're creating and what are the role models that we're giving you that will allow you to really maintain and develop your humanity while you develop your skills as a caring physician. So what should we do? Should we only recruit students that they have the empathy gene? Well, I don't think the Genome Project figured out what the empathy gene was. So we have to think about it differently. Is there something we could do to foster it? Interesting that researchers at Mass General Hospital actually have demonstrated that empathy can be taught, and your current empathy behaviors can improve. They actually have an empathy course, and they put physicians through that, and they found that they interrupted their patients less. They made better eye contact, and they were actually able to remain calm if their patients, because of the stress of their disease, became angry, frustrated, or upset. And they also appeared to develop a resistance to the notorious dehumanizing effects of a very rigorous medical school experience. In addition to reinforcing these behaviors in structured classes, students admit that having the right role models, which I actually believe you have fabulous role models here in Greenville, who help you create positive clinical experience and have a supportive infrastructure, will help nurture healthy physician-patient relationships. So emphasizing empathy and compassion as a core characteristic is really a top priority for all of us. So I tried to think, what words of wisdom could I give you that you might remember 8 years from now that will make you appreciate the importance of empathy and compassion, not only for your patients, but actually for your own well-being. So I have just 2 recommendations and a few stories. The first one is every one of your patients has something to teach you. I mean, the nurses and the other care team members are going to teach you a lot as well. But let's first focus on what patients can teach you. You need to listen to them. You need to be present emotionally and physically when they need you. My chairman used to say, sit down on the edge of the bed. Then their patient doesn't think that you're in a rush to get out of the room. Small tricks and small practices that can remind you to be there present for your patients will be very important. I'm going to tell you your interactions with your patients will be formative. I mean, they'll mold you as you are in pursuit of excellence and mastery in your specialty. But you will have some experiences with patients that will be transformative. They will change how you perceive yourself as a physician and the humanity you bring to your profession. Ask any of your faculty here in Greenville, and they will probably easily describe one patient interaction that changed who they were as a physician. So I'm going to share with you 3 stories and tell you what each of these patients taught me. Hattie was an 80-year-old South Carolina chicken farmer from Orangeburg. She was admitted for pneumonia to MUSC, and I was a 4th-year medical student. It rapidly progressed to adult respiratory distress syndrome. She was intubated, a tube was put in her windpipe, and she was put on a ventilator. And as she was ventilated for the next 3 weeks, she became progressively less responsive in the ICU. The first day she came in there, I held her hand and I talked to her about what was going on with her disease. And I didn't stop that. Even when she was unresponsive, I would sit at her bedside and hold her hand. And I observed that a lot of the attendings and residents would talk around her, but they never talked to her. But I can tell you, every day when I left her bed, she gripped my hand. Now, she died. And it was amazing to me that we had not had those important discussions as a team about what was valuable in life for her. I knew, but I think I was the only person that knew, that she would rather die than not be able to go back to tending her chickens in Orangeburg. And those discussions never happened. Talk about another case. Darlene was a 5-year-old girl who was run over by a school bus in an unmonitored parking lot. Her papers blew underneath the wheels, and an 18-year-old bus driver backed over her. She came in with a horribly crushed chest to the emergency room crying, and I saw the terror on her face. She miraculously survived a surgery, but actually had a fatal cardiac arrhythmia 24 hours later in the pediatric ICU. I raced up there with a code beeper, and almost the entire team was there, and we did everything we could to save her, including open cardiac massage. She didn't survive, but we all stood at the bedside, stunned and incredibly sad. My last case is Mary, who is an 80-year-old Charleston high school teacher who had horrible emphysema, lung disease from smoking, and a very high tumor compressing her spinal cord. And she had progressive weakness in her arms and legs. Nobody thought she should undergo anesthesia because her lung disease was so horrible. They thought she would never get off the ventilator. And she told me, she thought, I'd rather die than be bedridden and progressively paralyzed by this. She goes, I'm willing to take any risk. So we actually designed this incredibly unique anesthetic that I could only have accomplished with her as a partner, putting a tube when she was awake down her nose into her windpipe, to actually devise an intravenous anesthetic so she was spontaneously ventilating through the 8 hours of the case, and actually doing the procedure in the sitting position so her lungs wouldn't undergo those changes that occur when somebody lies flat for that period of time. To everybody's amazement, she was extubated at the end of the case and walked out of the hospital 3 days later. So all of these patients changed me in a different way. Hattie made me understand that the determinant of the quality of life really comes from the perspective of the patient, and it's important for us to have those discussions early with them. She also showed me there's a right and a wrong way to die. Darlene taught me how much pain you can feel for the injustice of the situation. And you can be a professional and be very human. Our humanity is what makes us great doctors. And Mary taught me courage, and that anything can be accomplished with your patient as your partner. So please remember that every one of your patients has something to teach you. The second thing I want to tell you is the things that are going to give you the greatest pleasure in your life are going to be the things that you give away. You will be paid very well for your expertise, and you will begin to truly appreciate the privilege and responsibility of being a physician, however, when you start giving back. It may take the form of serving the poor in your community, volunteering at local clinics, maybe participating in international charity organizations. It may be lending your expertise to friends, family, or neighbors when they have questions about their health care, and there will be a million questions, all from, does this mole look cancerous, to how does Medicare work? And be prepared to do that. Your contributions also may take the form of serving as a leader in your community, volunteering to run juvenile diabetes runs and walks and American Heart Association campaigns. It may mean serving on the board of a community charity where your accolade is going to be a heartfelt thank you rather than a lavish ceremony, but your impact will be great. Your ability to pay it forward may be also providing real leadership as a role model in clinical settings when young physicians and nurses, people that will follow you, are faced with the challenge of determining the right balance between professional distance and intimacy with patients. I'm going to tell you a dramatic example where I began to really teach my residents how to be present and how to role model for everybody else occurs often in the operating room. Sometimes, in spite of our best efforts, people don't survive. And there's a full court press with all members of the team working very hard with incredible teamwork to save a patient. But then the case is called, death is determined. I have seen immediately people turn away from the patients, strip off their gloves, and leave the room. I have seen people go and immediately start dictating. I've even seen my residents, anesthesia residents, and this one I started to get worried, turn around and turn off the monitor so they didn't have to hear that last agonal heartbeat, and then finish their documentation. The scrub nurse is usually left to close with often a young resident. This is an example when it's so important to bring your compassion and empathy physically to that room. The comfort that you can give to other people in the room and the role modeling for you to respectfully acknowledge the patient's passing by wiping the blood off their bodies, making them presentable to their families, reaching out and consoling those around you cannot be measured. Death is often unavoidable, but it should not be invisible. We are often witnesses to pain and suffering in the end of life, but we don't have to be passive spectators. We can give these people dignity and respect at the end of their lives, and this provides support for everybody else in the room. So the most important contributions you will make will be those that you are not paid a penny for. So in summary, your work is going to be tough and the hours long, and thousands of your peers in corporate finance and law would trade places with you in a second. There is no other career that will give you the personal satisfaction on a daily basis that you are making a difference in many people's lives. I'm a bit envious. I remember my first day of medical school. We didn't have a white coat ceremony. And Spence, I think we showed up in flip-flops and cut-off shorts, so we definitely didn't have a dress code. But it's a great journey of personal and professional self-discovery. You will be a different person at the end of this. Leaders that are defined by how you leverage the power of science with integrity and humanity to improve the health of all the communities you serve. Welcome to a wonderful profession. Thank you.
And with that, you can understand why we count as one of our blessings here, having Joanne as a colleague and a friend, even though she's from afar right now. And we figure every way we can to drag her back to Greenville at every opportunity. And we listen very closely to her when she's here for strategic planning sessions, when she's here for grand rounds, and when she's here for white coat ceremonies. Thank you, Joanne. It is my privilege now to administer the oath for the students of this class. For your consideration, the oath is printed in the program. The students, please now stand and recite the oath you selected for this white coat ceremony. Ryan, you want to start them?
University of South Carolina School of Medicine, Greenville, class of 2016, do hereby pledge to follow. We accept the privilege of being physicians in training. We will pursue the mission of the Greenville Hospital System to heal compassionately, teach innovatively, and improve constantly. We will give our educators due attention and gratitude, acknowledge the wisdom of our mentors, and seek to learn from all members of the healthcare team. We will treat our patients with dignity, respect their individuality, safeguard their confidence, and serve as their advocates. We will be active members in our community, striving to understand the needs and addressing the challenges of our patient population. We will work to maintain balance in our lives, remembering that caring for ourselves is just as important as caring for others. We commit to lifelong learning, preserving the foundations of the past, and embracing the innovations of the future. We acknowledge our limitations, regarding them as opportunities for growth. We will have the courage to suggest and implement the changes necessary to the advancement of medicine and healthcare. We promise to foster an environment of cooperation that encourages the success of each classmate and the class as a whole. We will cultivate our unique talents, promote individuality, and celebrate diversity. We will protect our enthusiasm and passion and remain forever grateful to those who made this journey possible. With humility, we vow to exemplify these ideals, acknowledging that our position as a charter class confers upon us a great responsibility to set and sustain the standards for future students.
Excellent. Thank you. So all I'll tell you is keep the programs, sit please, keep the programs because there will be times in some of your darkest hours and lowest moments that you ought to pull them out and read them again. So with that, Paul, do you want to come up and present the class?
Well, welcome again to all of you. The students are going to file out now. And as they file out, I want to remind you, if you would please, to not take any flash photography when each of the students has his or her white coat donned by our dean. Their picture will be taken individually, and as well, this entire ceremony is being videotaped and will be available to all of you. Finally, just as a reminder, if you would please, and I promise you there will be time for applause, lots of it, but during the particular time when each individual student is called, we would ask that you refrain from your applause. I think most of you know this, but if you don't, I want to remind you that that oath that we just heard, that I need to read every day for my own well-being, was put together by this class. And it has been already a remarkable journey. And this class would not be who they were without each and every one of you, parents, friends, spouses, other family members whose ongoing support allowed us to bring together a group of students that are talented and empathetic enough to put together a white coat oath like that. So it's a real privilege, and I know I speak for all of the faculty just to listen to this. And the students are getting ready now, and they are ready. Okay, that was good because I was afraid I was going to have to sing or something like that. So you notice my voice sort of trailed off there. So yeah, I will. And Dr. Taylor will be giving each of the students a commemorative coin, and with one exception, no one else has yet to receive any of these coins. So this is a real honor, I know, for Dr. Taylor to share this with the class. First student is Amr Ansari. Kara Barlow. Ryan Batson. Shea Bielby. Robbie Bonanno. Chanel Bonds. Natalie Bott. Phillip Callihan. Alexis Cannon. Shelley Caskey. Mauro Chaves. Thomas Cochran. Jensyn Cone. Amanda Craig. Paige Cribb. Kaiser Crum. Jennifer Davis. Matthew Eisenstadt. Eric Fulmer. Geevan George. Laura Golson. Trevor Gravely. Kristie Griffin. Myah Griffin. Maglin Halsey. Mollie Hamilton. Justin Harold. Jessica Himmelstein.
So my daughter's a left-handed surgeon, so figure.
Evans James. Keith Johnson. Alec Kitch. Stewart Lee. Georgia Lesser. Julie Lortz. Madison Merritt. Alysa Parshall. Christopher Parsons. Kathryn Peterson. Shane Regard. Jennifer Reinofsky. Kyle Ryberg. Elyse Sadow. Andrew C. Christina Shelley. Chelsea Smith. Dane Swinehart. Kyle Townsend. Charlotte Van Hale. Jeffrey Vanderwood. Ben Velke. Samantha Ward. Kindal Wessel. Darrell Wright. Okay. Dr. Yuki.
Thanks, Paul. Last evening, Sharon and I had the good fortune to run into one of the class members here in a local restaurant. We had the good fortune to have Stewart Lee introduce us to his father, Dr. Robert Lee, that I saw in the audience, his mother, Beth, and his significant other, Courtney. If I understand it correctly, Dr. Lee provides long-term care as a family practice physician with the Holston Medical Group in Kingsport, Tennessee. It was fortuitous for many reasons, not the least of which was it reminded me how far each of you has traveled to get here, both literally and figuratively. I thank all of you for joining us today at this University of South Carolina School of Medicine Greenville first white coat ceremony, and a special thanks to our Student Affairs Office for their efforts in arranging and staffing this ceremony under the direction of Associate Dean Jim Buggy. I'm sure you can appreciate, having seen these students and listened to them, what an exceptional group of young men and women are in this charter class, and I'll tell you they're off to a great start. In closing, I again express our appreciation to Dr. Joanne Conroy for her ongoing support and encouragement. As an indication of our gratitude, I am presenting to her the second commemorative medallion to be given outside the class. This is sort of an inside joke, but many of you will get it. The irony of it is so far both of these individuals have hailed from the Medical University of South Carolina, John Schaefer and Joanne. Joanne? And with that, one last round of applause for the class of 2016.